Welcome, friends. You are about to embark on an eye-opening journey through Nudge, Improving Decisions About Health, Wealth, and Happiness by Richard H. Thaler and Cass R. Sunstein. This book is not just about making better choices. It's about understanding why we make the choices we do and how small, well-designed nudges can help us make decisions that improve our lives. One should listen to this book because every day you make countless decisions: what to eat, how to save money, which career move to take, how to stay healthy. But what if you could make better choices without even realizing it? This book reveals the power of choice architecture, the way choices are presented to us, and how we can use this knowledge to steer ourselves toward healthier, wealthier, and happier lives. Whether you are a business leader, a policymaker, or simply someone looking to make smarter decisions, this audiobook will change the way you think about choice and freedom. Nudge teaches us that small changes in our environment can have a big impact on our behavior. You will discover how governments, businesses, and even individuals can structure choices in ways that help people without restricting their freedom. If you've ever wondered why you keep making the same financial mistakes, struggle to stay healthy, or follow the crowd without thinking, this audiobook will give you the tools to take control. So sit back, open your mind, and get ready to learn how to make better choices for yourself and those around you. 1. Biases and blunders. Authors begin by explaining how human decision-making is flawed. Unlike the rational econs in traditional economic theories, real humans suffer from biases and make predictable mistakes. The authors discuss common cognitive biases such as anchoring, relying too heavily on the first piece of information received, availability heuristic, judging likelihood based on easily recalled examples, and loss aversion, the tendency to fear losses more than we value gains. For example, when people are asked if the tallest redwood tree is taller or shorter than 1,200 feet, and then asked to guess its height, their answer tends to be close to 1,200 feet. This is anchoring. Similarly, they discuss how loss aversion makes people reluctant to sell losing stocks, fearing loss more than they value gains. Authors argue that if we recognize these biases, we can design systems that help people make better decisions. This sets the foundation for nudging. 2. Resisting temptation. One of the most common problems in decision-making is self-control. The authors discuss hyperbolic discounting, which explains why people struggle to make long-term decisions, such as saving for retirement or maintaining a healthy diet. Essentially, we value immediate rewards more than future benefits. To illustrate this, the authors mention a classic experiment. Participants are given the option to receive $100 today or $110 in a month. Most take the $100, even though waiting would be financially smarter. To combat this, authors advocate for commitment devices, strategies that lock people into making better choices. An example is Save More Tomorrow, a program where employees commit in advance to increasing their retirement savings each time they get a raise, reducing the pain of parting with money now. 3. Following the herd. Humans are social creatures and take cues from others when making decisions. The authors present research showing that people adjust their behavior based on social norms. For instance, a study on electricity consumption found that when people were informed that their neighbors used less energy, they reduced their own consumption. The effect was strongest when accompanied by a simple smiling or frowning face on the bill. This demonstrates how nudging through social norms can be powerful. The authors emphasize that while peer pressure can lead to negative behaviors, it can also be used to steer people toward better decisions in areas like recycling, voting, and charitable giving. 4. When do we need a nudge? Not all decisions require nudging, but some are particularly prone to poor choices. The authors explain that nudging is most helpful when choices are complex, e.g., selecting health insurance or a mortgage; infrequent, e.g., choosing a college major or buying a home; lacking feedback, e.g., investing decisions that take years to show results. For example, many people struggle with mortgage selection because the fine print is confusing. A nudge, like a simplified comparison tool, could improve decision-making. 5. Choice architecture. The heart of the book is the idea that how choices are presented affects outcomes. The authors introduce 6 key principles. Incentives. Make sure people are motivated to choose wisely. Understanding. Present choices clearly. Defaults. Set good default options, as most people stick with them. Feedback. Provide timely feedback to help improve decisions. Expect error. Design systems that minimize the cost of mistakes. Structure complex choices. Simplify options when people are overwhelmed. For example, in cafeterias, arranging healthy food at eye level increases healthy eating without restricting choice. 6. Save More Tomorrow. Authors discuss the Save More Tomorrow, SMART program, which helps employees gradually increase their retirement savings. Instead of asking workers to cut spending now, SMART commits them to saving a higher percentage of future pay raises. This takes advantage of loss aversion. People don't feel like they're losing anything because the money comes from future raises. The results? People who use SMART dramatically increase their savings over time. The authors emphasize that by designing choices in this way, governments and businesses can help people act in their own best interests. 7. Naive investing. Authors explore the behavioral biases that affect how people invest their money, particularly in retirement accounts. The chapter highlights the problem of naive diversification, where investors split their money equally across available options without understanding the risk-reward trade-off. The authors illustrate this concept with an experiment involving trick-or-treaters on Halloween. Children were given 2 scenarios. In one, they were asked to pick 2 candy bars at a single house, and in the other, they visited 2 separate houses and had to make a choice at each stop. In the first scenario, almost all children picked one of each type of candy. However, when forced to decide separately, many chose the same candy twice. This parallels how investors allocate their money. When faced with multiple funds, they often spread their money evenly without considering the actual portfolio composition. The authors also discuss the 1/n heuristic, where people divide their money equally among the given options. For example, if a company offers 1 stock fund and 1 bond fund, many employees split their contributions 50-50. But if the company offers a mix of balanced funds, stock funds, and bond funds, investors follow the same heuristic, often leading to suboptimal allocations. To combat these issues, authors advocate for better choice architecture in retirement plans. They suggest default investment strategies like target date funds, which automatically adjust the portfolio's risk exposure over time. These nudges help investors make better choices without requiring them to become experts in finance. 8. Credit markets. Consumers struggle with debt decisions, often due to complexity. The authors illustrate this with Homer Simpson signing a car lease without realizing the costly balloon payment. Key concerns. Mortgages. Once simple, they now involve complex options like adjustable rates and teaser rates, making choices difficult even for MBA students. Student loans. FAFSA forms discourage applicants. A proposed nudge. Pre-fill forms using tax data. Credit cards. The minimum payment trap leads to costly debt. A cost of credit statement could improve awareness. Clearer disclosures and better choice architecture can help borrowers make smarter financial decisions. 9. Privatizing Social Security. Sweden's privatized system required citizens to pick investment funds, but many made poor choices, leading to high fees and low returns. The authors argue for structured default options that guide people toward better long-term outcomes while maintaining choice. 10. Prescription drugs. Medicare Part D created confusion with too many plan choices. The authors recommend smart defaults that auto-select plans based on user history, simplifying decisions and improving health outcomes. 11. Organ donations. Authors discuss the problem of organ shortages and how behavioral nudges can help. They compare the opt-in system used in the US with the opt-out system used in many European countries, where individuals are automatically considered organ donors unless they explicitly decline. Studies show that opt-out systems dramatically increase donation rates without forcing anyone to participate. The authors advocate for a presumed consent model combined with an easy way for individuals to opt out if they wish. 12. Saving the planet. This chapter focuses on how nudges can promote environmentally friendly behavior. The authors discuss carbon taxes, cap-and-trade systems, and social norms as ways to influence behavior. For instance, they highlight a study where simply informing households about how their energy use compares to their neighbors led to significant reductions in consumption. Authors argue that leveraging social comparisons and small incentives can be more effective than government mandates in encouraging people to adopt sustainable habits. 13. Improving school choices. Authors examine how school choice policies can improve education, but highlight the need for better decision-making tools. They discuss how some parents struggle to evaluate school quality due to information overload and biases. An example from Charlotte, North Carolina, shows that providing simple fact sheets about school performance improved parental choices. They also mention a Texas high school requiring students to apply to college before graduation, which increased college attendance. The authors advocate for clear and accessible data, arguing that simply offering choices isn't enough. Parents need structured guidance to make informed decisions. 14. Should patients be forced to buy lottery tickets? This chapter critiques the American healthcare system, comparing medical malpractice insurance to a forced lottery ticket. The authors argue that litigation costs drive up healthcare prices, making patients indirectly pay for the right to sue. They propose allowing patients to opt out of malpractice lawsuits in exchange for lower medical costs, similar to how consumers choose different levels of car insurance. The chapter explores how defensive medicine, unnecessary tests ordered by doctors to avoid lawsuits, wastes resources. The authors suggest a no-fault insurance system, similar to those in Sweden and New Zealand, to simplify compensation for medical errors. 15. Privatizing marriage. Authors propose separating marriage from government recognition, turning it into a private contract like any other legal partnership. They argue that state involvement in marriage is an outdated practice, originally used to regulate sexual behavior and child-rearing. They note that religious institutions and social norms already shape personal commitments, making state-issued marriage licenses unnecessary. Instead, they suggest replacing marriage with legally recognized civil unions, allowing private organizations to define marriage however they see fit. This change, they argue, would respect both religious freedoms and personal choices while removing government-imposed definitions of marriage. 16. A dozen nudges. This chapter presents practical applications of nudging across different aspects of life. Examples include implementing cafeteria designs that promote healthier eating, structuring online forms to encourage organ donation, and developing financial tools that automatically enroll workers in savings plans. The authors also discuss a humorous but useful concept, a civility check for emails, which would delay sending angry messages to prevent regret. Each of these nudges illustrates how small tweaks in choice architecture can lead to better personal and societal outcomes without limiting individual freedoms. 17. Objections. The authors address criticisms of libertarian paternalism. Some argue that nudging is manipulative, while others worry about a slippery slope leading to excessive government control. Authors counter that nudges maintain freedom of choice and that, in many cases, decision-making environments are already biased in some way. They argue that structured nudges, such as opt-out savings plans or simplified mortgage disclosures, actually enhance individual autonomy by helping people make better-informed choices. The chapter reassures readers that nudges should be transparent, adjustable, and open to debate. 18. The real third way. In the final chapter, authors position libertarian paternalism as a middle ground between strict government control and unfettered free markets. They argue that well-designed choice architectures improve lives while preserving freedom. They use examples from previous chapters, such as retirement savings programs, environmental policies, and healthcare choices, to illustrate how nudging can be applied effectively. The book ends with a call for policymakers and businesses to implement nudges thoughtfully, ensuring they align with people's best interests while allowing for personal choice. Final thoughts. This book is a groundbreaking exploration of how small changes in choice architecture can dramatically improve decision-making in health, finance, education, and public policy. The authors show that humans, unlike the rational econs assumed in classical economics, are prone to biases, inertia, and poor judgment. However, by designing choices thoughtfully, whether in retirement savings, school selection, or healthcare, governments and businesses can help people make better decisions without restricting their freedom. The book's central message is that nudging is not about coercion, but about making better defaults, structuring choices to align with people's true preferences, and overcoming psychological pitfalls. From retirement savings plans to organ donations, from climate change to school policies, nudges offer a practical and ethical way to steer people toward better outcomes. Authors leave us with a hopeful vision, a world where smart design, behavioral science, and ethical governance work together to help individuals and societies flourish. Their final call is for more thoughtful policymaking, one that respects freedom but acknowledges that well-placed nudges can make life healthier, wealthier, and happier.